Welcome, everyone, to a very special week of the Brain Warriors Way podcast. We have my friend and also colleague at Amen Clinics, Dr. Kabran Chapek, who is one of our staff physicians at Amen Clinics Northwest in Bellevue, Washington. He has worked with us, my goodness, for the last 6 years. Wow. He's a graduate of Bastyr University. He's an expert in the use of functional and integrative treatments, collaborates extensively with the 40 physicians we have at Amen Clinics. He has a special interest in the assessment and treatment of Alzheimer's and dementia, traumatic brain injuries, which we're going to talk about, post-traumatic stress disorder, anxiety disorders. He's the founding president of the Psychiatric Association of Naturopathic Physicians. He has a brand new book that I'm so excited about and wrote the introduction to called Concussion Rescue, which is going to be released January 28th. It's going to be available everywhere. Welcome, Kabran. What a joy to have you on the Brain Warriors Way podcast.
Oh, my pleasure. I'm excited to talk with you both.
So 40% of the patients who come to Amen Clinics have had a significant brain injury at some point in the past. It's a staggering number. I actually think it's one of the epidemics driving the rise of mental health challenges in America. So why Concussion Rescue? Why did you write this book?
Daniel, I wrote this book because there's so many people who need help. Like you said, it's a silent epidemic. And there's those who have had concussions and they're not getting better. You know, the assumption is you have a concussion, you get better, but not everyone does. And that's why they come to see us. Not everyone can come and see us. They need help. And that's one set of people who need the book and they need the help. The second set are those who have some other mental health issue or neurological condition that maybe have memory problems and they're not getting better and they can't figure out why. And it actually may be due to a past concussion. We see these, like you said, 4 out of 10 people come in to see us and they have had some issue, and then we scan them and we find out they've actually had brain injury as part of their.
Yeah, when you and I first started dating, I scanned you. Right. I mean, that was just absolute prerequisite before I completely fell in love with you. I mean, I was very taken with you.
Best line ever.
Right away, but I had to see your brain. And we could see in the left side of your brain, it had been hurt. And I asked you, did you ever have a concussion?
I am a neurosurgical ICU nurse. That means coma, brain drain, like that's a head injury.
Right, but so often, and you said no, and what I've learned from looking at all these scans over the last 3 decades is, well, are you sure?
Right.
Have you ever fallen out of a tree, fell off a fence, dove into a shallow pool, been in a car accident, and what did you say?
Yes, my sister fell asleep at the wheel going 75 miles an hour, rolled the car 2.5 times. Yeah. And I thought because I essentially walked away from it without being hospitalized, never lost consciousness, that I was fine.
And you were how old when that happened?
25.
So this was after the cancer diagnosis.
Yeah.
And
after all of that.
Prozac and all
but what you're saying makes me think of a really good point. And with your book, Dr. Kabran, is that so many people don't really understand what brain injuries are. We just did a podcast and we scanned Chris Browning, who's a very successful actor who did heroin once for 6 years. So it ended up homeless. And when I first asked him if he ever had a head injury, he said no. And as he begins telling me his story, I'm like, you need to write a book. Like, his story is insane. And the number of times that he's been knocked out, literally knocked out, one time overnight, was unconscious, and didn't think of it as a brain injury. And I just, how is it possible that we are so uneducated still? Which I'm assuming is what you're trying to help with your book. But I think we don't know.
So let's go over, so how do people get head injuries? What are some of the most common causes of brain injuries, head injury? I mean, it's the same thing. Concussion just means you hit your head really hard and it had an effect.
Exactly right. Exactly. A concussion is a form of traumatic brain injury. It's more mild, but it's still a traumatic brain injury. And it can happen from a hit or a jolt to the head, even whiplash. It's horrible, but we think shaken baby syndrome. I mean, that's jostling the fragile brain. We know, I've learned from you, the brain is so soft, it's as soft as butter. The skull is hard as a rock. And it can be damaged also from our veterans who have blast injuries. That concussive force will completely penetrate the skull and the brain and damage the soft brain.
So I want you, if you're listening at home or in your car, wherever you are, I want you, as we go through different age groups and the kinds of head injuries that are common, I just want you to ask yourself, have you ever had a brain injury? And so you mentioned shaken baby syndrome. And I have a granddaughter who I'm completely in love with, who's so busy, just like her mother. And there's so many different ways Haven can get a head injury.
No, I almost watched her do it like 5 times in an hour. It's crazy. You have to have your eyes on her.
Down a flight of stairs to tripping over something to irritating the dog, and the dog knocks her down, to being so wiggly on the changing table, falling off, to being irritating. And I'm not saying she's irritating because she's not. She's great.
Well, to us, she's not.
But to an impulsive parent, when you have a hyperactive child, you may shake them or hit them just because of your high level of frustration. And this is just for hyperactive infants. And so
let's not even get into teenagers.
Riding your bicycle. And people think helmets protect the brain. They don't. They protect the skull. They protect the skull from being fractured, but inside your skull actually has sharp, bony ridges. God and I have had this discussion about why didn't you put bumper guards on those sharp ridges? And he told me, I didn't know they'd let kids hit soccer balls with their head. That's stupid.
That's right. You don't have to lose consciousness to have a concussion. That's another myth people think. Or if they haven't gone to the ER, I wouldn't have had a concussion, but a fall off a horse, diving into a shallow pool. We try and ask patients, 10 times, because we minimize it. Or if you didn't lose consciousness, it wasn't concussion. Or there's amnesia around head injuries, so you often forget. And also there's sometimes distance. So I had a pastor who came in. He was had a car accident, thought he was fine, got checked out at the ER, no brain bleed. And then 2 weeks later, he couldn't write a sermon. He was completely confused. And we know that when there's an injury, there's that immediate damage to the vessels and some swelling. But then there's secondary injury where there's a chronic inflammatory state. It's like a fire that hasn't been put out that continued to smolder for months and sometimes years. And that's what I'd like to help people figure out, that this inflammation can be quenched and the brain can heal, even if it's been
all right. So have you had a brain injury? Or if someone is suffering in your family that you're worried, and that's why you're listening to the Brain Warriors Way podcast, it's just so important to know if it's true, because we can rehabilitate it. I mean, I think that's the most exciting thing that you've seen and that I've seen, which is why we did the big NFL study, high levels of damage. It's like, stop lying about it, but rehabilitate them. And that's what we are going to start talking about in the next podcast. So stay with us. We're with Dr. Kabran Chapek, the author of the new book, Concussion Rescue. If you really want to know the method of how we treat traumatic brain injury and concussions at Amen Clinics, this is a great resource. It's a great book for you to pick up. Kabran also is going to have a new course at Amen University called Concussion Rescue that we're really excited about. So if you want to get into the deep end of the pool, stay with us.
Fantastic.
We'll send out a notice of when the course, it's already recorded, but when it will be released. Stay with us. We are going to start your new year, your new decade off with a bang. Tana and I are going to do a 6-week live class. So starting January 21st, every Tuesday, we're going to be with you for an hour. And at the end, we're going to give away over $20,000 in prizes. We look forward to helping you kick off this new year by becoming brain health revolutionaries.
Welcome back. We are still here with our friend and colleague, Dr. Kabran Chapek, and we are having so much fun. And we're talking about something really serious, though. Your new book, Concussion Rescue, which really outlines how you treat patients through our protocols at Amen Clinics, and really excited about that. And I also am really excited about the course you're going to put together with that, Concussion Rescue. So that's just fantastic to be able to hold people's hand through this process, educate them on what it really means to have a brain injury, because we talked about how so many people don't actually know. So thank you for being here with us and talking about your new book and the new course.
So when someone has a concussion, what's the first thing they should do?
Well, if it's severe, of course, the standard protocol, go to the ER, get CT scan, MRI, check for brain bleed. The standard protocol is fine. Like, in fact, we've reduced the death rate from 40 to 50% down to 20 to 30% in the past 30 years. So that's huge. We don't want to minimize the good work of the neurosurgeons and their teams, miracle workers. However, the death rate has gone down over the past even 5 years, but we've seen a rise actually in patients going to the ER. There's now nearly 3 million people going to the ER with a head injury, mostly kids 0 to 4, and then older adults, but also many people in the middle. And sports teams, standard protocol, watch and wait, rest, progressive exercise, both schoolwork, going to work, using your brain, and also physical exercise. But then that's kind of it. And it just leaves so many people without enough help. And 20% to 50% will go on to have post-concussion syndrome or chronic symptoms from their brain injury. Could be memory problems, could be depression. Like we were talking about earlier, depression can come out of the blue. And I don't know why I'm depressed. When you think back, it could be due to an injury. We need to do more to actually help the body and the brain to heal and facilitate that healing. And specifically, it's that quenching of inflammation, the chronic, it's like a fire that hasn't been put out and it continues to smolder. There's excess glutamate, it's excitatory neurotransmitter, there's excess calcium, there's swelling, and also there's a metabolic deficiency. Like, the brain is a very hungry organ, uses a lot of energy, and it's not... it's damaged so that it can't use the energy as well. So the brain needs a lot of help and a lot of support. And part of why I wrote this book is that there's actually thousands of studies that tell us and clue us into some of the mechanisms that are really helpful at healing the brain. Yet the standard protocol is very basic and doesn't utilize any of this. So I would like to see a big change in the standard concussion protocol in schools and physical therapist offices. I mean, they're doing great work, but it's just we need to do more.
So early on, there's way more things people can do than they're typically told. So yes, you should go to the emergency room and have a neurological exam. And if the neurological exam shows trouble, you should have a CT scan to rule out a bleed. But unfortunately, that's where it stops for virtually everyone. The emergency room doctor says, you're fine, go home, rest. Maybe they'll go see your primary care doctor. There's this one study from UCLA where they gave rats a head injury. And one group, they gave their standard healthy diet to. The other group, they gave their standard healthy diet and fructose. They put fruit sugar in there, which, just think of Gatorade on the sidelines of games. The rats that had the healthy diet in 3 weeks could run the mazes that they knew how to run. The ones that got the fructose, the excess sugar, couldn't. They were still confused. And so immediately we want all of our brain warriors to change their diet to a low sugar, anti-inflammatory diet, which you talk about in the book. So right away, eating better can be helpful. And then you and I've been talking about nutrient support. So if you've had a concussion acutely, that there are some nutrients that can be helpful to prevent the damage that is occurring from the excess release of calcium and glutamate and inflammation. So talk about that for a minute.
Yeah, so the way to really quench the inflammation, in addition to, like you said, I love that. See, that's the evidence we have, the research. The higher sugar diet is perpetuating that inflammation. But taking targeted nutrients, vitamin C doesn't get enough respect. We need more vitamin C. The brain uses a ton of vitamin C. It's an antioxidant, quenches inflammation. Simple vitamin C right after a brain injury is something very simple. Vitamin D. So there was a study out of Iran in 2013 where they had, for acute brain injury, they had a placebo group, progesterone and vitamin D group, and then a just progesterone group. And they found that those who were given progesterone and vitamin D right after, and these were acute, Glasgow coma score less than 8. So some of these patients didn't survive. Some of them died. 65% had good recovery, which meant either they were sort of back to normal, in quotes, or had minor disability, the folks who had the progesterone and vitamin D, whereas 45% who had just progesterone and 20% who they did standard procedures. So vitamin D is a real key. And in this study, they used about 13,000 international units a day, which is a higher dose, but it's not, you get 10,000 international units when you go out into the sun, not maybe where we're at in Seattle, but maybe down where you are, you get a lot of sunshine and 10,000 international units on a sunny day. So that's something, is vitamin D. And another thing is that if folks are deficient in vitamin D prior to a brain injury, it's been shown they have poorer outcomes. Kind of like.
So let me just stop you there. Those of you that are listening, vitamin D is a universal risk factor for trouble. Cancer, depression, Alzheimer's disease, diabetes, heart disease. All of you should know your vitamin D level now. Normal's between 30 and 100. We think optimal's more like 60 to 100. And you should optimize it, because what Dr. Chapek just said is if you get a head injury and you have lower vitamin D level, you're at more risk. And this is so stinking easy to fix.
Right.
And Neurovite Plus, which is the multiple vitamin mineral supplement we create directed toward your brain, actually has 2,000 units of vitamin D. And why did I do that? Because there's actually a study that said that decreased cancer risk by 30%. That level.
Speaking of cancer, so I go to a doctor who is he's a research specialist up at UCSF, not a functional medicine doctor, so technically. He actually gets a lot of criticism because he practices more like a functional medicine doctor. So when I first started seeing him, my vitamin D, and I take a lot of vitamin D, because I know it's good, right? But I think it was around the 60 mark, and he's like, no, we need to increase that. I was like, what? I've never heard a doctor tell me that, ever. Usually my doctors say your vitamin D is either really good or it's a little too high. And so in his case, he's like, no, I want it actually closer to 100. And I was like, wow. I mean, and it's because of the cancer. So.
And look at you. You're just like so amazing. It's probably the vitamin D
It's the
level. Omega-3 fatty acids which
Critical.
is another thing that you recommend.
Critical.
It's anti-inflammatory. It provides support for the membranes that have often been torn or ripped.
How much do you recommend for someone with a concussion? Like what? It's higher, correct, than the regular what you'd recommend on a daily maintenance basis for fish
I
oil?
mean, there's a lot of research. Some say you need very high doses, 5 grams a day, 9 grams a day. I don't think it needs to be that high. I think 3 grams a day is sufficient. I think when we want to target a lot of different mechanisms. Cell membrane stability, anti-inflammatory. That's the omega-3 captures that. Vitamin D, anti-inflammatory, immune modulation. Vitamin C, water-soluble antioxidant. Another one I like to mention is NAC, or N-acetylcysteine. And this is a supplement. It is a precursor to glutathione. Our body's one of our main antioxidants. And they did this really cool study with humans. So often these are animal studies, but this was a human study in the field. So at war, these active military, 81 of them, double-blind placebo-controlled trial in 2013. And they had, if they were suspected of having an injury, they would go to the medic and they would give them a large dose of NAC and then follow them over the course of that week. And at the end of a week, 84% of them had improvement in their concussion symptoms, and only 42% who didn't have NAC. So both groups got better, but significantly better with NAC as this antioxidant.
Wow.
And that's just NAC.
And what was the dose? Do you remember? Was it a gram of NAC?
They actually gave them, immediately they gave them 4 grams. And then days 1 through 4, they gave them 2 grams twice daily. And then days 5 through 7, 1.5 grams twice daily. So it's fairly heavy doses.
But you can buy this at the health food store. These are not outrageous doses that you could buy in the NAC usually comes in 600 milligrams. And so you load it for the first week, and you talk about this in Concussion Rescue, you know, what are the dosages? It's just such important information for you to have.
I wish it was on the sideline of football games. You know, some of these treatments, you know, high school football, these kids are having concussions and watching and waiting. My own son plays basketball, and when I see a concussion happen, I'll go and offer some help. You know, if they need to be seen, they'll be evaluated. But the parents are just so grateful because they feel helpless. It's like, what can I do to help my
Well, and this rest and see if you get better is just stupidity as far as I'm concerned. It's like you put the brain in a healing environment immediately. If you break your leg, they don't go, well, let's see. They work on rehabilitation immediately. And I think this is just, it's a discussion we have to have, which is why I'm so pleased you have written this book. When we come back, we're going to talk about more strategies that you write about in Concussion Rescue. Welcome back. We're here with Dr. Kabran Chapek, and we're talking about traumatic brain injury, concussions, his new book, Concussion Rescue. Kabran, you and I have shared a lot of patients over the last 6 years, and I'm always very grateful for you because, you know, I help with the psychiatric stuff, and you make sure to put their body in a healing environment. And together we created the mnemonic Bright Minds, which is really a functional medicine approach to mental health, brain health. And we've talked about Bright Minds a lot. But go through each of those risk factors as it relates to concussion rescue. So B is for blood flow, and we see that on the scans, right? We see low blood flow 91% of the time in the frontal lobes, which, you know, that just hurts everything in your life because it hurts decision making.
No, it's a brilliant mnemonic, and the more I use it with patients, the more sense it makes as we apply it to the different conditions that we see. And so, of course, blood flow. Yeah, the vascularization, we need more blood flow if there's been a brain injury. The R is for retirement. And as an aging brain, you know, as I said earlier, you know, highest rates of brain injury are those either young adults, 0 to 17, and then over 65. And the brain is more vulnerable, but there's also falls are higher in these populations. I is for inflammation. As we talked earlier, there's a cascade of inflammatory events that's like a fire that hasn't been put out and continues to smolder for months and sometimes years after brain injury. Genetics. So learn this from you. ApoE4, people who have the ApoE4 genotype are more likely to suffer the long-term consequences of brain injury because the ApoE4 allele is a gene. It's known as the Alzheimer's gene. But what it really means is that this person who has ApoE4 is more pro-inflammatory. They're going to have more inflammation in their body than someone who doesn't. And so it's just, it's so much more important to do all of the things we're talking about.
So get this, Kabran. 2004, I wrote my book, Preventing Alzheimer's, with neurologist Rod Schenkel. And when I reviewed that literature, Rod and I came out and said, if you're going to let your child play a contact sport, you first need to know their ApoE4 status. So it's just a simple blood test.
Brilliant.
That, you know, ApoE gene type, so APO gene type, and it'll tell you, are you an E2? So it's 2, 3, or 4. Or, you know, do you have 2 2s, 2 3s, 2 4s? And if you have 1 4, you probably shouldn't let your child play contact sports because there's a study in boxers. Those boxers who had one of the E4 genes started to show cognitive impairment after their 11th fight.
Wow.
Those boxers who had no E4 genes actually did not show cognitive impairment until after their 30th fight.
Big difference.
It's because they're producing more inflammation faster? Is that...
Well, and it's also involved in cholesterol metabolism as well, but it increases the risk of cognitive impairment with whatever insult you have. And I would bet, because we've also been talking about general anesthesia, people don't know this. General anesthesia for vulnerable people, it's a brain injury. It's an assault on their brain, and probably people have the E4 gene have more damage from anesthesia. And these risk factors stack. They link, they stack, and then they attack you. And so low blood flow, if you're older, that's worse. If you have inflammation because you have a highly processed diet, if you have genetic vulnerabilities for anxiety, depression, Alzheimer's disease, the E4 gene, so recovery is really dealing with all of that. And then the T is toxins, which I actually learned from your mentor, Joe Pizzorno. He's got this great book, The Toxin Solution, to scare the socks off you.
Yeah, he's great.
But we really live in a toxic environment, don't we?
We do. We're kind of surrounded, kind of bathed in it. So we all need to do things that help us detoxify, whether it's doing saunas regularly or taking our antioxidants, vitamin C, eating our vegetables. But
where does hyperbaric oxygen fall in here?
So blood flow. I'm so
With this
happy
treatment,
you brought that up,
I mean, I got one in my house because like I'm so in love with it. I go in every day. It's when I meditate. It just clears my brain. So it just is so peaceful. And I know it's doing something positive.
If I could only do one thing to help heal the brain from brain injury, it would be hyperbaric oxygen. If I was only limited to one tool. It's that powerful. And it doesn't help everyone. And it doesn't help as much if you just do that. But it is a powerful tool.
But if you combine it with the rest of your protocol, then it's very powerful.
That much better.
And so M is either mind storms, these abnormal electrical activity, common in head injuries because the temporal lobes where they come from sit right behind a sharp bony ridge that needs a bumper guard. So I'm praying for that. Or mental health challenges. If you have ADD, you're more likely to get a brain injury because of the impulsivity, as we talk about Haven, my granddaughter. I mean, I don't know that she has ADD, but it wouldn't surprise me how busy she is. And
she's like a wind-up
the
toy.
Impulsivity increases the risk of brain injury. But if you never had ADD until the car accident you got into when you were a teenager, and now you have ADD, that's not really ADD, that's traumatic brain injury where you have frontal lobe trouble.
I had a nurse she wanted to become a nurse. Name was Jane. We'll call her Jane. She was 35 and she thought she had adult ADD, but she had been in a car accident and she had difficulty focusing, was given Dexedrine, a stimulant, helped a little bit, but she couldn't study until she got treatment for also her brain injury. And then she could focus and study. I was able to complete nursing school.
So important. And then the I is immunity and infections, which you and I have seen is so important. But some autoimmune problems are really caused by gluten and dairy and corn and soy. So doing an elimination diet can actually be really, diet's just a central piece to all of this. And then, hormones. So N is neurohormone deficiencies. And you write about that in Concussion Rescue about how testosterone, progesterone, thyroid can all be off after a head injury. Why is that?
Yeah, great question. So 25 to 50% of people with a history of brain injury have damage to the pituitary gland. It's the master hormone gland sitting in the center of the brain, in the sella turcica, the sort of bony pocket, and it can be damaged through the same ways other parts of the brain can be damaged. And if it's taken out, it's not sending the signal to the other parts of the other hormone systems, so thyroid, adrenals, the testes for testosterone, for women, ovaries, estrogen, progesterone, and also growth hormone. So the top two, we typically see growth hormone deficiencies and sex hormone deficiencies, whether that's testosterone or estrogen, progesterone. And this is especially high in the veterans with blast injuries. So I think that concussive force gets to the pituitary in particular. It can penetrate more deeply. So it's important to screen. And I talk about all the labs that should be done in the book, but checking all of these hormones, but also the pituitary hormones, because they're often damaged. And these can be corrected. And it's like we need those growth factors. That's kind of how I characterize them. These are growth factors for healing. We have the nutrients for antioxidant and feeding the system that way. But then also we need to have sort of the growth factors for healing as well with the hormones. It's like two halves of a coin.
So important to get your hormones checked. And then D is diabesity. 70% of us are overweight, 40% of us are obese. I've published 2 studies that show as your weight goes up, the size and function of your brain goes down. So you're more likely to have lasting trouble if you have trouble with your weight. And you're more likely to have problems with your weight after a head injury, because if 91% of head injuries affect your frontal lobes, then, in our society with this incredibly bad food, you're just going to make a bad decision. And just
Absolutely.
think about it. When you think about the magnitude of this problem, every year, what did you say? 3 million people go to the ER for a head injury, and most of them live. And that means over the last 40 years, there may be over 100 million people walking around with the effects of concussions.
And Daniel, I think it's so much higher because those are just the people going to the
Right.
ER.
I was going to say, a lot of people don't go. Homeless people don't go.
Like you didn't go, and you had
I thought I was fine.
very brutal
Right.
car accident. And people don't think of the whiplash injuries. It's like they think of that as a neck issue. Well, what's happening in your skull where your brain is not fixed? It floats in water.
I want to correct that. I actually did go. We had to because our car stopped or whatever. They took us to we were in the middle of nowhere. They took us to this little tiny hospital. And he checked out the rest of my body to make sure I didn't have any broken bones. He quickly flashed my eyes and that was it. I was done. And I thought, well, I'm fine. I walked away. So,
I think you're
That's
fine.
very common.
But we can
so
see
it's not that I
evidence
didn't
years
go.
later.
It's that it wasn't taken very seriously because I walked away.
No, they still don't take it seriously. So when
and
we
ER
come back,
doctors have it.
when we come back, we'll talk more about it. I mean, we could talk on and on, but Dr. Chapek's new book, Concussion Rescue, out January 28th. He's going to have a
Very
new course coming out shortly thereafter.
I'm so excited about the course
University.
to help people with the book.
Stay with us. A resource to save your brain and your life.
Welcome back. We are still here with our friend, Dr. Kabran Chapek, and we're talking about his book, Concussion Rescue. Such interesting conversation through this week, just about, how many people get head injuries and don't know it, aren't treated for it, aren't properly treated for it, and are walking around with the effects of head injury. I was one of them, so I understand. And it's just astounding, but there's hope and there's help. And so we're talking about some of the risk factors, but also what you can do. And I'm so excited, not just about your book, Dr. Chapek, but about the course. There's just something about that I think is going to be really helpful to people to walk them through with you holding their hand. So I'm excited about
thank
that.
you.
So we sort of ended on D in Bright Minds, diabesity, and how critical it is. Because if you're overweight, you automatically have 4 of the 11 Bright Minds risk factors.
Yeah.
If you're overweight, you have more inflammation because belly fat actually produces inflammatory adipokines that increase inflammation throughout your whole body. Fat stores toxins. So you have more toxins and you have lower overall blood flow to your brain, which is the study I published in normal people and in our NFL group. So working on getting your weight to a healthy level. I love this. I have this new story. I'm seeing the son of a very famous bad guy. And it's just been 2 months. He's lost 30 pounds because he just does everything I ask him. I love that. Those are the people who get better.
But you're bringing up a good point because so many people think that when we talk about weight, we're body shaming. No, it's not about that. It's about your health. And weight isn't easy for everyone to lose. But if you're having trouble with your weight, you need to be checked out. And I personally think that you need to be checked out on multiple levels. Biological, obviously, to see if your hormones and everything else, your
or
nutritional.
if you had a head injury.
Right. So biological, psychological, if you've got a lot of excess baggage from the past, you need to, deal with that. Social, your social circles matter when it comes to your weight because people are contagious. So weight is tricky and it's not about us body shaming. It's about us wanting you to get better. And so if you're struggling with that, it's complex. It's not one thing. It's not a matter of willpower. It's way more complex than that.
But much more common in concussions and head trauma because 91% of them affect the prefrontal
and
cortex.
hormones we just talked about.
And that leads us to ask,
Yeah.
is sleep problems become very common after a head injury?
That's right. Yeah, I was actually giving a lecture at a brain injury conference about 4 years ago, and someone in the audience asked me, why do people with brain injuries always have sleep problems? And I was kind of stumped, like, okay, what's the actual mechanism? So I had to go back to the literature, look at this. One of the reasons is just less melatonin production.
I was wondering.
So there is less melatonin production. Melatonin is a hormone that can be very over the counter.
Yeah, I have to take it. And maybe, I think it was after the head injury, I can't sleep without melatonin. Like I can, but I'm fitful. I don't, it doesn't, plus the thyroid. So melatonin is and magnesium, so helpful.
So helpful.
So you're on board with this fact that you had a head injury?
Well, I am now. Didn't have a choice after I saw my brain. I'm like, it's either that or I have a really bad brain for no reason. I have this little dent in the front.
And the other reason is hypocretin. So hypocretin is it's a wake promoting hormone. So it's the reason often people are really tired after brain injury.
Interesting.
It keeps people awake. And so it's suppressed for a subset of patients after brain injury. And so often people feel, and just there's damage. And so the neurons aren't firing properly and in sequence and in series. And so it's kind of like your neighbor with their music on, and it's sort of keeping you awake at night. And then during the day, it's annoying. It's just sort of like there all the time. So the neurons aren't able to shut down when it's time to go to sleep. And they're not able to wake up fully and have good focus and memory when you're awake. So it's
another part of that is the lower frontal lobe function. What most people don't know is the frontal lobes are in large part inhibitory. What that means is they send signals to your emotional brain to settle down.
So when you start spinning on thoughts.
And so when you take the frontal lobes offline, your amygdala and your hippocampus start screaming at you every bad thing that ever happened.
Not just that. I'm like one of those people in the middle of the night, all of a sudden, wake up. I have a list. I have like a list in my head at 4:00 in the morning.
I'm so glad you don't wake me up and tell me the list.
But I mean, I'm wondering, is that common for people who have had head injuries, like what you're saying? If that inhibitory process isn't working, are we more likely to start spinning on stuff at night?
Yes, absolutely. Yes. What about the Irlen syndrome? What I've found is it's so common in people who have traumatic brain injury.
It is.
They're light sensitive. Their depth perception's not as good. They have headaches. When they read, letters or words might move on the page or they get blurry. And wearing colored filtered lenses is so
really
helpful,
helps.
so healing. Some of my NHL players actually wear colored tinted masks when they play because their depth perception is so much better. And so I think almost anybody that's had a concussion should at least get screened for the Irlen syndrome.
100%.
And we had 100%. Helen Irlen on a couple of times.
So interesting.
I'm like a huge fan. You just need to like do these things. And so it just, as our time comes close to an end, it's insane. And I'm a psychiatrist. I can diagnose insanity. It's insane to have a significant concussion, go to the emergency room, and then have them go, you're fine, even after a CT scan. You're fine. Just go rest.
We've seen so many people's lives destroyed from that process.
Well, it's a cause of suicide. Undiagnosed brain injuries is a major cause of suicide. It's a cause of homicide. It's a cause of homelessness. Another brand new study out, 50% of homeless people had a significant brain injury before they were homeless.
Wow.
In Toronto, that number is 58% for men and 42% for women. It's a major cause of depression, of panic disorder, as you talked about, Kabran, ADHD. And how would you know if you didn't look? There's this great study that they actually scanned people right after they had a head injury. And if their scan was normal, they had a 100% chance they'd recover well. And if their scan was abnormal, that wasn't predictive because the brain has many healing mechanisms. But 9 months later, if it's still abnormal, it predicted with a high level of certainty you're in trouble. And so that's where SPECT, I think, is the best tool because an
hands
MRI
down.
and a CT scan show structure, but they don't show function.
But wait, so you're saying after 9 months, if it still has problems, you're in trouble. But what does that mean? Does that mean that even if you didn't treat it right then, is there still hope later if someone treats it?
If they put their brain in a healing
So let's say they
environment.
didn't put their brain in a healing environment for several years, 5 years, 10 years. They suffered those consequences, but then they realize they can still be better.
In fact, in my NFL work, I treated a lot of older NFL players. Some of them were in their 60s, 70s, even 80s. And 80% of them were better 2 months later if we're doing the program that Kabran talks about in
So
Concussion
the brain's more
Rescue.
plastic than we've given it credit for.
The brain is more mendable, more moldable. Tomorrow, your brain can be better if you sleep better tonight, if you eat better today. Your brain, and it can be worse.
Right.
I did a scan of a news anchor recently, and the scan looked terrible. And I'm like looking at him like cocaine, heroin, what is this? And he got no sleep the night before. And so I'm going to scan him again to go, is his brain just terrible that we need to fix? Or was it the severe sleep?
Well, and we've seen the same thing with severe dehydration. People's their brains look terrible.
Your brain can be better tomorrow by doing the things that
I'm so
Dr.
excited about your
Chapek
program.
talks about
Thank you.
in his book, Concussion Rescue.
I'm partially so excited about it because I answer questions on social media. So many of them are people just are terrified after having a concussion and they don't know what to do. And even if you tell them what to do, it still seems a little abstract and vague to them because this is what we do. This is not what they do. And they need someone to hold their hand because they can't focus. So the daily process of holding someone's hand is just going to be critical.
And so hopefully if you're listening to this, you can just see how insane the current recommendations are. And our recommendation is immediately you put the brain in a healing environment, just as if you broke your leg.
Yeah.
It's so important. If they take the course, once the course is out, what are they going to learn beyond what we've talked about today?
They're going to learn what labs to have their doctor order for them. They're going to learn more about specific nutritional recommendations, for example, how the ketogenic diet may fit in. It's not for everybody. It's a therapeutic diet. And it can be very healing for some people. I had a patient who was a airline pilot, and he went out for drinks when he was in Australia, got punched out, and couldn't fly back. And
That's why I don't go out for drinks.
And so he was suffering for many months, and he couldn't take pills anymore. It's like, I couldn't do supplements. What's one supplement I can take that will help me? And I said, don't take any supplements, do the ketogenic diet. If you want to do one thing, let's try the ketogenic diet. And in several weeks, he had more energy. He was sleeping better. And then he was able to take the supplements and do it all. And now 2 years later, he's finally going back to work.
Yeah, it's a
and
good
able to
point.
be
Sometimes
employed.
one step
would
leads to
recommend
another.
2 of our supplements. So if you're like, what's the least I can do? It would be 1 scoop of the Bright Minds powder.
Yeah.
Because it's called Bright Minds powder because we go after all of these risk factors. And take omega-3
Hits them
power.
all.
Take between 2 and 4 of omega-3 power and 1 scoop of the Bright Minds powder. That's where I would start. And
Absolutely.
it's that formula that I used with our NFL group. And we showed significant improvement. Well, you are a joy,
awesome.
as always.
Concussion
we love
Rescue.
You. We appreciate you.
My
I am
pleasure.
so proud of you for writing this book, for talking about it. This is just an issue. It's not going to go away in your lifetime or my lifetime. And it's a needed resource, and you are a brain warrior, and we're proud of you.
Thank you, Dr. Chapek.
Thank you so much. You're both inspirations to me, and thank you so much for having me on. It's been an honor.
Thank you.
It's an honor to work with you.
Great. All right. Brain Warriors Way podcast. Stay with us.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're considering coming to Amen Clinics or trying some of the brain healthy supplements from BrainMD, you can use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or a 10% discount on all supplements at brainmdhealth.com. For more information, give us a call at 855-978-1363.